Matthew Hancock, Matt Hancock, Secretary of State for Health and Care. A very good morning to you.
Good morning, how are you?
I'm all right. Three things I want to talk, and I know you're really up against it on time. First of all, on COVID-19, aiming significantly to increase the amount of COVID testing. How can you learn from even 150,000 people how fares the health of the nation when there are 65 million of us? And why are you randomly testing folk who've got no symptoms?
Yes, well, Alastair, this is an incredibly important project. And this survey, which we're increasing by about 10 times, is the single most important piece of information that we get in terms of what's happening in the spread of the virus across the country. And because testing people who have no symptoms is really important for finding out where the virus really is. We know that around 3/4 of people who have the virus don't have symptoms, so they don't know that they have it. And finding people who have the virus but don't have symptoms, and then making sure that they don't pass it on is critical. And understanding where the virus is, where
I understand that.
The country.
But forgive me, you'll understand why I say, and I say it on behalf of folk listening. Yeah. First of all, the Isle of Wight testbed app was going to be the answer. Then National Register app was going to be the answer, and then knocking on doors by local people in places like Blackburn and Manchester was going to be the answer. And now it's a sample of 150,000 people. You're making it up as you go along on testing, Matt.
No, on the contrary, all these things are part of the answer, and they're all things that I've come on this show and talked about, and they all play their part. So making sure that we have this survey, knowing which parts of the country, for instance, are most affected, that's important. So too is where you find an area like, as we've seen in Leicester, for instance, where you've got a big outbreak, having those people part of the community knocking on doors and finding the people who test positive, that's really important. But you need to know where to send them. So you need the survey. And in fact, Leicester's a really good example. The other news out today, which is that we've been able to lift a whole load of the local lockdown in Leicester, showing the local lockdown system working, because thanks to the efforts of all the people who've been working on it and the people of Leicester, we've been able to take that action. So you're quite right. There are many parts to this response, and all of them have got their part to play.
Why are you choosing right now, with the genuine risk of a second wave, to abolish Public Health England and put in charge of your new institute a woman who is, Dido Harding, not perceived to have done brilliantly in running all of the previous testing programmes that you've asked her to run?
Oh, on the contrary, Baroness Harding has done an exceptional job in building testing capacity, in building a contact tracing system on a scale never seen before. And she has huge experience both in the public sector and the private sector. She's chaired the board of NHS Improvement for 3 years.
She also ran a company that had one of the biggest data breaches on record.
Well, anybody who has huge experience will have had things that have been a challenge, should we say, on their watch.
So a colossal failure qualifies her for one of the most important jobs for the national health, Matt.
Well, I tell you what qualifies the people who I asked to do these important jobs. It's, can they deliver? Can they provide the leadership that's needed? And the answer with Baroness Harding is undoubtedly yes, and she's been demonstrating that as a key part of the team in the last few months.
I know her because actually the three of us have a horse connection, and we have an interest in that. She is an honourable woman, I know that, and she's very, very bright. But Talk was a catastrophe, but also you needed to keep nudging her at every move on track and trace. The targets were simply not met time and time again.
But that's not right, is it? Because we hit every target that we set on the expansion of testing.
But 60% wasn't the target on tracing, and that's roughly what you're hitting at the moment.
Well, the goal on the amount of contacts of people who test positive who we reach is to reach 80% of them.
Yeah.
And we currently, on last week's figures, we reached 79.7, and we said that we'd get to that 80% figure by the end of August. So 79.7 it's not quite there, but it's pretty close. And considering that system has been built in a matter of a few short weeks, the key is how can we be best prepared for the future to try to make sure that we keep these rates down, especially as in other countries, like France, Spain, we're seeing the numbers pop up. And bringing the different organisations that you mentioned together under new unified leadership.
So that's thumbs up for Dido and the idea of it. But why now, Matt? As I said, we do face. I mean, I know you're optimistic and hopeful, but there is a real threat out there of a second wave. That's why you're stopping Julia Hartley-Brewer go off for a holiday in France. That's why I'm here. And yet you suddenly chuck it all up in the air.
I didn't know that I'd had that impact on Julia's summer holidays. It is we are.
You asked Grant Shapps, she gave him what for over it.
Oh, really? Is that right?
But anyway,
we do have to make some difficult decisions, sometimes unpopular decisions, to do the right thing, to according to our best judgment, to grip the virus. And
but that means doing the right thing. I can understand that, but you've also got to do the right thing at the right time.
Yeah, exactly. So I was just going to come on to that point.
I apologise.
Not at all, because it is an important question. It's a balanced judgment when you do these things. But in my experience especially of the past 7 or 8 months in this crisis, is doing the right thing, but doing it too late is usually an error. And since my judgment is that bringing together these different organisations under single leadership will strengthen the response as we go into the autumn and the winter, and will help us in preventing a rise in the number of cases. And that's why I've taken the decision now. You're absolutely right that is there's a balance there, it's always easier, frankly, to wait and do something later. But I'm convinced that taking this action will strengthen our response now.
The most logical conclusion from that answer, and I didn't interrupt that bit of it, is that you are more worried than I thought you were about what is going to happen in the autumn and the winter. You need to make that change right here, right now, because whether it's a second wave of COVID-19 or a nasty brand of flu that somebody has whispered in your ear, how worried, Matt, are you about the winter, let alone what's left of the autumn?
Well, I am worried about it, but it's my job to worry. What I can tell you is there's nothing that I know about it that I'm not telling you. The surveys of how much the virus is changing, the survey we started off talking about, which is our best guide to it, showed that the number of cases is basically flat. But all you have to do is look across the channel, and you can see these countries that had the virus completely under control, where it's shooting up again.
Yeah.
And so of course I'm worried, but I'm paid to be worried. I'm the health secretary in the middle of a global pandemic. But I'm not unduly worried. And the decision to bring together these organizations now is actually because we have the situation broadly under control in this country. Now is a moment that we can make this change to be stronger, to prevent that second wave arriving here. And we're constantly vigilant. This is a constant daily discussion about what do we need to do to stop a second wave here, especially as, I talk to my colleagues in other countries and they thought everything was under control and suddenly is on the way up again. Sure. And
two very quick final ones, because I'm looking at the clock and I know what your schedule is like. The first one is what we started talking about, this new national testing pan of 150,000 people, what have you.
Yeah.
Is there within that hope for people who want to go off on holiday and have a kind of test at the airport when they come back, rather than simply being told flatly, either you don't go or you're quarantined for 14 days?
Well, I would say there is hope that we can move on that, but not yet. We're working with Heathrow on what we can do on that, but we aren't in a position to make a change to the rules yet, but it is something that we're working on. Because, look, I get the impact of quarantine. Of course I do.
Okay, honest and crisp answer. Thank you. Final point. Will you go to Rishi Sunak and say, can we please lift the cap on medical schools? We're letting people reading English, economics, PPE, the rest of it, all will have lots more, but we can't educate more teachers, more kids who want to be either doctors or dentists. Will you ask Rishi to give you the money to do that? We need those doctors, don't we?
That is a live conversation. Fortunately, the good news, Alastair, is that we had already expanded the number of medical places this year. It's the biggest ever, and that's good news. But clearly, we now have even more people who've got the right grades and want to study medicine. We need to expand the NHS. We're putting the money in to expand the NHS. We need more doctors in the NHS. And so, you know, and we are already expanding the number of places. But clearly, after the decision that was announced on Monday, we're also urgently looking at what further we can do.
Brilliant. Live conversation.
So a live conversation. It's not a no.
Okay, give me a bell when it goes from live to hard up, and we'll talk about it again. Thank you for finding time for us this morning. I know it's been a hectic one for you. That was Matt Hancock, the Secretary of State for Health and Care.